So firstly, thank you very, very much for three distinct but actually overlapping in some way, presentations and approaches. I suppose one of the first kind of questions I'm going to ask, really, and we are getting questions coming through on the Q&A as well, which I'll have to bring in into that, and I will do. And thank you to the people asking those questions. And I'll bring some of those in. We've seen this kind of reframing of entomological activities in terms of a public health reframe, making this entomological vector control activities public health. I want to widen that question to you all, and I want to ask that, should this be a socio-economic case? I mean, you're building one, Mitra, at the end of your study. Ryan, you're in a position where there's no integrated disease control reporting system at national level. You have to build a case for that. You've identified the gaps, training gaps, and you've identified some of the community gaps on education, awareness, that type of thing. Soumya, you guys have got a very good, robust kind of system in place. But I'm just wondering, do we need more? Do we need to be making a socioeconomic case here? You've just explained your side, Mitra, for a second. Ryan, from your perspective, to get these policy triggers in place, these policy people to put the funding in and make this happen at national level, is that socioeconomic case something that you would look to build in terms of vector controller intervention?
Yes, thanks, Kamran. I do think so. Socioeconomics is so important, but particularly where it's quite depressed. In terms of dengue, it creates so many opportunities for the vector to thrive when you have things like reduced sanitation or quite clustered populations, people in close proximity, and typically that's associated with a lower socioeconomic status. So you can kind of make that connection. As you increase, you're going to reduce those sort of high risk activities, such as increased sanitation, high population density, things like that, or at the very least, increase the ability for the people to protect themselves with the resources that they have. So I think it's a really important component of the disease prevention framework and whole world that socioeconomic status be addressed. Thank you.
That's a great answer. Only a few papers. You mentioned Professor Dom Shepherd's paper and a few others there, Mitra, and yours. There doesn't seem to be that much work in that. Perhaps I'm wrong. If I am, please let us know, the audience. But I think there's a case to be made there in terms of these interventions and then the cost to the country. What I would like to ask is, to Soumya, what would be your recommendations to someone in Ryan's position in terms of this integrated country disease surveillance network? What would be your recommendations to Ryan in terms of from your experience at the Pakistan national level?
I think it is very important, and I always say that dengue is not a medical problem, it is a social problem. And with all the social problems, we do calculate the economic burden. Whether it is because of the interventions that we need to put in effort for the control system, or the burden of the healthcare system, which the patients have to get hospitalized and get the treatment. So I think this has to be looked in the broader perspective of a socio-economic problem. And in the policy making, whenever we have a component of health, there should be a component of socio-economic part of that should be a socio-economic burden of that disease. But I think because we are facing so many challenges in the health sector these days, so many viruses, I must say, like dengue, and now we have COVID. So it has to be under one roof of probably epidemic prevention and control program, which then caters to the different components, which is the research component, the fieldwork component, the hiring of the people component, and the socioeconomic component and awareness component. But it has to be a holistic approach covering all the communicable diseases under one roof, because we cannot have a system for one virus and then another comes and then we have to get in place another system. So it has to be a complete system, and these should be the subcomponents of that system.
That's a very good answer, and I totally agree. These are at the end of it, these aren't just diseases, these are communities with diseases at the center of it. They'll have different, the same communities could have different diseases. A very good answer, and I think very apt. Mitra, you were nodding there, and you're about to start your cost-effective kind of the impact, as it were, of having these preventions or not having them at country level for scale up. What would be your recommendations, or what would be your insights into this socioeconomic question?
The socioeconomic, I mean, yeah, I think this is the really most important point when you work on a disease that cause hospitalization, and because I think when you look at the amount of money that are spent yearly for vector control programs, reactive vector control programs, it's such a huge amount of money, and they don't really stay for long. For example, space spraying is just 24-hour stable, and then you do a very good reduction of the mosquitoes, but they come back again. So yeah, I think it's very, very important to have more and more of this cost effectiveness analysis in order really to shift the policy for prevention rather than treatment.
Yeah, that's a great answer, and I thank you for that. We have got some kind of questions coming through from people from the audience, which we'll try and bring some of this into it. There's a specific question for you, Ryan, by Dr. Nurul Husna Abdul Hamid from the Institute of Medical Research in Malaysia. And Nurul Husna is asking, what is the primary vector for dengue transmission in Ethiopia?
Thank you. So it looks like from the outbreaks we've investigated that is Aedes aegypti, and it seems to be moving around with the different populations as they move through the country. We have identified Aedes africanus, however, in the periphery of some outbreaks, so it's possible that africanus is also participating on some of the kind of ecotones of the forest and community levels, but it seems to be predominantly Aedes aegypti.
Okay,
Thank
fantastic. Thank you for that. There's a question or series of questions that have come through. I believe these are for Soumya, but I'm sure we could always ask this to Mitra as well. From Dr. Kien Kwok Do, who's saying, thank you for your presentation. May I know whether only confirmed cases are recorded in your surveillance system? And I put that to Soumya for a second.
Malaysia, go ahead. Then I can answer.
Okay. So in Pakistan, we have a very robust reporting system, and we record all the suspected, probable, and the confirmed cases. So that's how we do the analysis. Just for the clarity of everyone, I will just give the definitions of suspected, probable, and confirmed in our country. Only the patients who have clinical signs and symptoms suggestive of dengue are labeled as suspects. If they have a blood test, which is CBC, supportive of dengue with thrombocytopenia and leukopenia, we label them as a probable case. And from them, we run the confirmatory tests, which are NS1 antigen, PCR test, and IgM serology for these tests. And if they turn out to be positive, we label them as a confirmed case of dengue infection. So we do capture all suspected, probable, and confirmed cases. And during the inter-epidemic period, the case response is done on all suspected and probable cases as well, because the disease burden is low and we can cater to a lot of people at that time. And we know that probable and confirmed are a subset of suspected cases. From the suspect, they turn to probable and confirmed. So if we have the resources at that time during the inter-epidemic period, we do the case response. But when the numbers are high and the disease burden is on the higher side, we do the case response only on the confirmed cases.
Okay, fine. That's a great answer. Thank you for that. Mitra, you were going to say something, I think.
Yeah, so in Malaysia, the system is all quite similar. We capture all confirmed but suspected cases, but before 2014, all these suspected but also confirmed cases were recorded at the end in the system. But from 2014, only laboratory confirmed cases are recorded at the end in order to know the real number of dengue cases per year.
Okay, so they're quite strict definitions, and you're sticking to those in terms of the, that's great. Just we're kind of running out of time. I'm being warned about the time as well, so I'm just trying to rush into the questions a little bit. So you have to forgive me for that. But in terms of this, I suppose one of the questions that has to be asked is, how have you found COVID and the social restrictions, the kind of lack of travel around, or just the kind of the restrictions around social distancing, example, how have they affected your work or the way that you would view the community and its engagement with vector control? Or I'll ask that to Mitra first, if possible.
Yeah, sure. So our work was not really affected by COVID, thanks to real efforts done by Institute for Medical Research and Dr. Husna, who was asking a question here, who is the principal investigator in Malaysia. We had only 2 weeks of really stopping work at the beginning of the first quarantine in Malaysia in March 2020. And then the Institute for Medical Research wrote a letter to the Ministry of Health asking that we have to continue. And so we could really continue in slower, but we continue our work. They prepared the SOP. There's really for field workers, how to go there, how to do it, keeping all this distancing imperative. Everything was very, very good. And well, okay, at the end we have 11 months of delay because the number of people who can go to the localities, to the cluster to do the spraying was divided by 2. But I think really with these efforts of the field workers and the principal investigator in Malaysia, we didn't really have lots of problem. A delay, of course, yes, but not really a lot of problem in conducting our trial.
That's a great answer. Thank you for that, Mitra. Ryan, in terms of your kind of approach, how did COVID affect? I know you had Mulugeta looking at the community engagement side and everything, but just from the overall kind of feeling that you got, are people more, I suppose I'll reframe the question, after COVID, people are far more aware of disease, of infection, what it means to them, and they're kind of perhaps potentially more switched on to those type of behaviors that would mitigate the outbreak of such diseases. How did you view COVID and its effects on the communities you were working with? Were they more on your side or less, or how did it work out?
Well, there is definitely, I guess, in an observational sense, you could definitely see where we were located in the capital that there was an increased awareness, a lot more conscious wearing of masks, separation of distance between peoples as best as possible. In some areas, it just was difficult, such as public transportation and things. But you could see that people were really making an effort, and so that's kind of my best frame of reference. ADS doesn't really operate up there. ADIS is quite high. I think it's around 3,000 meters or so. So in some of the lower land regions, I can't particularly speak of as another issue of COVID. It really prevented us from doing much travel. But I could say from observation in ADIS, it really did make a kind of infection prevention and a conscious point on people's minds. And I could see that making its, stretching out from COVID to other things and being a benefit along the way, or at least having populations more receptive to hearing about different, mitigation measures as they've seen what COVID can do to disrupt the lifestyle. So I think it did have a bit of an impact.
Yeah.
Okay.
Sonia, in terms of your approach, did your tracking system COVID proof the kind of community engagement stuff that was going on? What was your feeling on that? Where are you guys with that in terms of the effects of COVID?
I think it was totally different in two opposite ways. Because there was limited mobility of people because of the lockdown situation, people used to remain indoors more, and they had less chances of bite, and the disease burden reduced. But on the other hand, because there was a lockdown situation, because of the severe COVID pandemic that was going on, the field staff, which was doing surveillance in the and taking environmental samples, they were also not very active, and they sometimes did not have access to the indoor surveillance as well because people were afraid to let them in. So the numbers did drastically go down of the number of cases, and we reported no death in the last year, 2020. But I think there is a contribution of a little underreporting because of the restrictions that we had in place because of COVID-19. So when we do the analysis of our last years, we usually do not take 2020 in that analysis very seriously because we all know that because of COVID-19, whole of the health system was more directed towards COVID rather than dengue. So I think there was a benefit, but at the same time, it led to the underreporting, and we must have missed few cases as well.
Yeah, so a bit of a mixed bag in terms of the effects of that. That's a fair point to make. We're kind of running out of time, to be honest with you, and so to get into the nitty-gritty of this is going to be a bit difficult now. However, I will come to the kind of from the end questions I had in mind for all of you, was that you're in a way you're pushing certainly cross-sector collaboration, or the need to, you've identified gaps, all of you in your own ways, and you've also identified roads that would lead you out of those gaps, whether it's with the educational awareness raising at community level, developing champions on that basis, whether it's through this the RCT that you're doing, Mitra, whether it's through these kind of the information technology board and bringing that type of information in Somya. So I suppose I wanted to ask you, and I will ask this, you're all on our dengue advisory group in any case, with Bayer represented by Mitra. What would a World Dengue Day mean to you in terms of, from your professional perspective? How would this work? Would it be how would this work? What kind of effect would it generate, having that event horizon, a World Day galvanizing everybody? How would that work? Ryan, I'll ask you first.
Sure. I mean, my first reaction to that would be just kind of an increased awareness of it. Something like that would put on a world stage. You just have a more understanding. I mean, from a U.S. context, I mean, we do have some issues down in the southern parts of Florida or so, but otherwise it's really a kind of a foreign idea. And, with the changing dynamics of the world, it's very possible that dengue is going to increase its reach all over the place, the US and everywhere, really. So, I mean, a day that was highlighting this, that's able to kind of show the negatives, but as well as the way forward, how to prevent these diseases, how to protect yourself, how you just kind of grow that education, I guess, to go back to that component. Because in many places, it's not something that's really on the forefront of anyone's minds. And if something pops up out of nowhere, there's going to be a lot of confusion. So the more awareness, the more knowledge, the more it can be something at least people have heard of and they can file away to one day, access if need be, I think would be the most important and beneficial component of this day. And really what I would love to see come out of it. Thank you.
Thanks a lot for that, Ryan. So awareness and knowledge building. Somya, what would be your take on a World Dengue Day? How would this help?
I think it's a great idea. Even before we got in touch, that I had floated a World Dengue Day campaign on the social media as well. Because I think dengue, being the fastest growing infectious tropical disease, is a global threat and very rightly labeled by World Health Organization. And if anything kills the mankind in next few years, there are going to be viruses and microbes and not nuclear weapons or missiles. So I think it is very important to create awareness about this preventable disease, because we all know that prevention is always better than cure. So if we raise awareness by dedicating a day, it will consolidate all our efforts to a single day, and the impact can be more powerful rather than we celebrating it at different regions and at different days, and there is no voice heard at any forum. So combining all these efforts together in a single day is a brilliant idea, and hats off to you, Kamran, for taking this initiative and International Society of Neglected Tropical Disease to taking it to another level, where we talk to UN General Assembly and World Health Organization and every possible forum that is there to raise our voice.
I really appreciate you saying that. So I mean, actually, it's our hats that should be raised to you, Toff, to all of you for making time out of your very, very busy professional lives to do these webinars and push for this advocacy. We cannot say thank you enough. So thank you, but we can't say enough. Mitra, in terms of your kind of view on a World Dengue, you're now dealing with targeted fogging, auto dissemination traps. You've got this community engagement triage, and then you've also got this socioeconomic case building to get stuck into. How would a World Dengue Day help you?
So of course I agree with the two other speakers about using this day for a day of awareness and more knowledge about dengue, sure, but I think it could be a very, very nice opportunity also to share experience. For example, we are doing an RCT, and we face a lot of different various problems. So maybe in case one other country would like to set up such a trial, maybe these days could be a very nice opportunity to change together in order for the other country, to learn about what we had to face. And so that they can do other in another way in order to avoid some problem we had faced. And also for people like us who are doing trial to learn from other experiences in other part of the world.
That's a great answer, and I do think we are really one of the kind of ethoses here is really progress through partnership, and I really hope even within this panel that there's some forward movement. That's a huge RCT, 80,000 people, major insights with the government, with the Malaysian government. Somya, your work, Ryan, I really would hope to see in the future some collaborations, even from this panel, let alone from the wonderful attendees from all over the world that are joining us for these 3 days. So let's hope it does catalyze that, and let's kind of fingers crossed for all of that. I'm being warned specifically that we're out of time and they're about to release the trapdoors and I can fall through the floor. So I would just like to say, before that happens, thank you very, very much to Mitra, to Somya, to Ryan.